I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Pregomega Plus. Pregomega Plus supports a healthy diet before, during, and after pregnancy. During pregnancy, there's an increased metabolic demand, and proper nutrition is essential to optimize the health of both mother and baby. Pregomega Plus is a comprehensive, all-in-one prenatal vitamin and mineral supplement that contains the active form of active folate, calcium, iron, zinc, omega-3, and many other essential vitamins and minerals for mom and baby. Pregomega Plus is recommended to be taken prior to falling pregnant and conception, during pregnancy, and whilst breastfeeding. Pregomega Plus contains a month's supply of 3 tablets. One tablet is a multivitamin and mineral tablet, which is purple. The second one is the omega-3 fish oil capsule, the gel capsule. And the last one is the calcium combination tablet, the yellow tablet. For more information, visit www.pregomega.co.za. Welcome to another episode. I'm so excited about today's episode. I've got 2 amazing guests for the show. We're in for a treat. And I am personally very excited because they are my colleagues, all midwives. And we're going to have midwife talk today. The one midwife is Melissa, she's here with me, and Susan. And they're going to be telling more about themselves, so I'm not going to do that job. And then we're going to be talking about everything you need to know about the different hats that midwives have, depending on where they're working, and what are the limitations, and what are the freedom they have in their sectors. And we hopefully will make some good recommendations for you. For if you are pregnant and looking for your birth professionals, we want to address all of those wonderful things. So welcome, thank you for coming. And shall we start with you, Melissa?
Look, we'll start with me, oldest
Yes.
first. Thank you for having us, and thank you for this beautiful day. We have, as usual, it's always an inspiration to be anywhere with midwives. We love it. So who am I? What am I? I worked in the private sector for over 17 years. And I chose to leave the private sector and take a leap of faith and do home births. So I've become an independent midwife. I've been doing it for just under 3 years now. And I do home births. I care for moms while they're pregnant. I care for the dads as well. Mm-hmm. I care for them after the birth. I assist with breastfeeding. I am there to help them throughout the birth, as well as guide them. But the most important thing I can say out of what I do is I work with low risk.
Yes.
I have a fantastic team that I work with gynaes, chiropractors, homeopaths. We all work together. But if you're not low risk and you're tempering on high risk, unfortunately, you need to be with my colleague in her little spot. Mm-hmm. So, yes.
Right.
Okay. Hi. Susan, I started in government. I always say I was grown in government. It's a different type of midwifery, and then left that and went to private sector. So I worked in private hospital for goodness, so was it like 10 years? And most of my experience in midwifery has been in a private hospital setting. But once you've learned the freedom of looking after your patient by yourself and being able to make decisions on your own, like government sector midwives, it sometimes is hard to, I don't want to say conform, but to accept the rules a little bit when it comes to private sector midwifery. But yeah, so worked at a private hospital and fought quite a bit as my bosses. I think I gave them all headaches all the time for what I felt was right.
Right.
And I mean, I know I'm not the only one. I know you also fought when we were working together. And yeah, so mostly what we had was a lot of high risk pregnancies, so like your placenta previas and so on. Saw a lot of abrupt shows and prems and things like that. And every now and again, you would have the low risk mom. And that low risk mom would give you that little bit of freedom to play with positions and things like that. And that was really nice because you get lost in the medical, clinical thing of it.
Yeah.
So every now and again, when the low risk mom comes through, then I get very excited. But yeah, so that is me.
Awesome. Yeah.
That is me.
Wonderful. So just for the listeners, both Melissa and Susanne has been through the sensitive midwifery course,
Yes.
and they are absolutely sensitive midwives at heart. And we need those midwives everywhere. For me, it's like you are a real midwife. It's you understand true midwifery, natural midwifery, and supports that. And you also know when medicalization is needed,
Yes.
and when to refer timely, and how to still, provide very sensitive care, even if they have complications.
Yes.
And that is what all women deserve, right? Good woman-centered care. So let's unpack it a little bit. I know you've already touched on quite a few challenges that you find in working in the private sector in South Africa. But what are the highlights for you?
Highlights, good highlights or challenging highlights?
No, good highlights.
Good highlights. Well, when it's a high-risk pregnancy and this mom has walked a road to be able to get pregnant, so it's like an IVF baby and it's been a challenging pregnancy and now she comes in for her delivery and you're still trying to give her that moment of delivering her baby and having all of that while everything is medical and clinical around her. And then being able to place that little person on mom's chest. Man, those are the moments that it makes you feel like a midwife. It makes you feel like you've done something amazing today. And then you walk out of that room and you walk into the next patient's room and it's a whole different challenge. But being able to, in a high-risk situation, have a mom and a baby that's healthy and safe, I would say that is my highlights. Over the years, I've had a few patients that have crept really into my heart, and I still have contact with all of them. I still see my babies grow up. And so those are the little highlights, remembering what we went through to be able to put that baby in mom's arms and then getting to see that little person grow up and become a little person of their own, like personalities and things. That is, yeah. But I must say, doing the sensitive midwifery course was a beautiful thing for me because it made me fall in love with midwifery again. And when I went back, I think this was one of the discussions we had in the tea room, was me feeling like we need to change, we need to do things differently. And then every highlight started becoming even more special because you realize a little bit more. You get lost in the private sector, in the medical thing of it. But when you just focus on being the midwife and your focus is solely on that mom and that baby, those are the moments that really make it worthwhile. Absolutely.
I think you nailed it. Yes, that's definitely what midwives boxes tick. Hey,
I have a very different perspective of it.
Yes,
Because I get to see them. So I see them throughout their pregnancy. We do work with gynae backup. You have to have a gynae backup. That's not a discussion.
Yes.
It has to be done. But I see them from 15 weeks, sometimes earlier. So I actually feel them grow. And I feel how they grow inside the tummies. And moms always laugh at me because I say they're my babies until they're born. When they're born, they're yours. But until they're born, if they're naughty, I will moan at them. If they turn to breach, I'm like, move your bum the other way around. So you actually feel as the mom grows, you feel as everything expands, as her son expands, and you watch them come into the roles of the mom. You watch them to come into roles of the family, and you get to meet them. I meet all my clients in their home. I like to, because you see the environment that you're in. I have births that the cats and dogs are involved in the labor. They're involved in the birth. I've had photos of them, and you have the dog right next to mommy when they deliver. It's perfectly fine. I get to know that my mom's like music, don't like music. I have that intimate relationship with my moms, and they never leave you, and they're always there for you. And I've got a few seconds and thirds coming up now, and you realize that each time it's just another friendship that you renew. It's not something that disappears. And something someone said to me, one of my moms actually said to me, is the joy of having a home birth compared to a hospital birth is someone only comes into a room for 20 minutes, maybe with a hospital birth. With a home birth, someone's there 24 hours a day. The longest I've ever been with mom is for 36 hours. And you'll go, 36 hours, why didn't you transfer? But she was progressing normally. She just needed time.
Yeah.
And to sit, and when I have this mom that's taken a long birth, and I've noticed that the head is slightly deflexed, where we were always taught, put a vacuum on, change it and move it. We have all this wonderful knowledge out there that shows us how we can adjust the mother to help the baby turn. So when you've had a baby with the mom sitting at 9 centimeters and the baby's fine, but the head is just not coming down, you figure out these skills to kind of work out, obviously it's research-based, how to rotate the baby so that we can get the baby out. And listen, we do weird things. We do very weird things. But we get our babies out. And just by changing the mom's positions, relaxing her muscles, and those are the highlights. The whole process, because I see that birth and I literally seriously, you made me work my tush off to get you out here, but at least you're out. The expression on the mom and dad's face, finding that position for them to deliver in, and then afterwards, seeing as they grow into their role as a mother, their role as breastfeeding champions. And I mean, I'm very blessed. Most of my mom's breastfeed. So seeing them to grow into these champions, having that support. I've got into my car at 2:00 in the morning to go help mom with the breastfeeding. And that, you're there and you watch how they grow as women. And then you see as the babies grow and you have contact with them. So I think the process is a huge highlight for me. And each birth is individual. Each birth is unique.
Yeah.
And that's what I love. And no matter if it's the same mom, they will have a different position. The baby will turn differently. The baby will hit this little nerve. And then discussing with the mom, like, baby's on that nerve. Well, hello, he's checking the little pelvis and pushing nerves here. So he's having fun inside there. And explaining to them, you watch as a mom bonds with this baby. So
Beautiful.
starting from 15 weeks, you go the whole way through. And that's what's nice. You have this relationship.
Yeah, that is really rewarding. That is so rewarding. I can totally imagine that. And I know that side of midwifery very well. Melissa, then from there must be I already can hear a downside of it too, because you need to be extremely available. And
yeah, there are downsides. There are days that it gets lonely.
Lonely, yes.
There are days that, okay, I'm never off. I am never off. I don't ever go off. I'm very blessed that I've got very understanding children, but you're never off. And my phone is always on. I'm always available. If I have to go anywhere, I have to inform my moms, I'll be away for this time. Are you okay? Are you stable? But the biggest downside, that I can cope with. That doesn't faze me. Even the loneliness sometimes when you want to bounce an idea of someone, you really can't. You don't know who to bounce it off. I can even deal with that. But what I struggle tremendously is to be treated as not a professional.
Right.
That I struggle with incredibly.
Yes.
Because even speaking to, I've ordered blood results. I've picked up something that I'm concerned about. I've said to them, this is my concerns. I don't think this client can stay with me because I'm worried she's high risk. Send to the GP sees her, because with today, not all of them can go to the gynae immediately. So if it's little things, I send to a GP first. And the GP looks at my patient, visits them, says, no, he thinks there's nothing wrong. You can go. And then requesting that the GP please phone me so that we can discuss this, because I did send a referral letter. Please discuss this with me. No response comes. I transfer a mom in, or I've transferred a baby in after birth, and I'll say to them, everyone goes with referral letters. This is what's happened. Please phone me if you have queries concerning the birth. Please let me know what's happening with the baby. And you get nothing. You get quietness. And then having to phone them and ask them, and they're like, no, doctor can't talk to you now. So could you possibly email me? No. And then sometimes I'll get a standard email that will say noted. and then you like almost want to wring a neck. It's like that I struggle tremendously with. It almost feels like you're a substandard citizen type of thing. So that I find is the patients, all of that I can handle, but that I find very difficult.
Yeah, and that is a big challenge in our settings, right? And also contribute to the loneliness because you don't feel necessarily the support you need. Yeah, and I think there's a lot of work to be done there just in how they perceive independent midwifery. And it's good for women to know that it's a systemic thing that we're still working on, is the acceptance of independent midwifery, the safety of it, the good collaboration. Yeah, I can imagine that that gets to you. Yeah, there's work to be done.
No, but I found that in other settings, like in Joburg and in Bloemfontein, I know midwives who've gone independent and who have beautiful backups and like they do amazing things. They've established birthing homes and things. Why is it that in our area, you girls get so much like pushback? It makes no sense because you take the brunt of the work, like you take a lot of it off the pressure of the doctor so he can focus on the high risk situations so that you can actually look after the low risk mom. I mean, I'm going to say this again, you know, I've said this how many times. Before there were doctors, there were midwives. We were the ones teaching them how to do PVs and how to deliver babies. So why all of a sudden do they not trust us? That makes no sense.
I think the thing is, you must also realize there's people that have come along and broken the trust. So there has been situations of trust being broken. And that's why we have to prove that we're better, that we can work harder. And it's a trust issue.
Yeah.
I'm very blessed. I have a phenomenal backup gynae that I know I can always work with, but also she's also busy. She also has her own clients. But I know if I have any queries, she's amazing. She is caring. She is loving towards my patients. And if it wasn't for her, I don't think I would get through half things. I mean, I couldn't work without her. But it's when you have to go out of that comfort bubble, and even simple things like trying to order stock. I had to find somewhere that was willing to work with me, which is, it gets difficult. But at the end of the day, it's all worth it. But trust has been broken. And that happens. And because of trust being broken, and we're an unknown entity. Joburg has how many? I mean, Joburg, Durban, Cape Town, they have how many? Come to PE, I think we have like 3 or 4 if we're lucky.
Yeah, we only have a few.
Yeah, so we're a very unknown entity. So I think time will go and we'll eventually get there. But it's education, and this is how we do it. It's education through the mothers being educated, how to choose a provider, how to look at your providers, because also to look at their stats, to ask about their stats. I've had a patient that phoned me at 11 weeks asking if I can come see her. And I'm like, okay, but you're a hospital patient. Is there a reason you want? No, the doctor says I'm severe preeclamptic and I'll need a Caesar. I'm like, you're 11 weeks. How are we preeclamptic? So she's like, no, she's severe preeclamptic. And, you know, things like that.
Wow.
It's the knowledge is not there.
Yes.
So the knowledge will come, and it's not going to happen overnight. It took us a while to get here.
Exactly.
So get to know your service provider, get to know what they stand for, look at their stats, ask around, speak to people.
Yes.
And at the end of the day, I'm not saying don't go to a gynae. Please, if you're high risk, go to a gynae, go to a hospital. That's where you must be. But yeah, just get to know who you're working with.
But also be able to choose, like as a woman, you know, have the options. Women in other areas have a lot of options. In our area, minimal. And most of the people, there's this culture that, oh no, you're pregnant? You're 6 weeks pregnant? Oh, congratulations. When are you going to see your gynae? You know what I'm saying? That's the first thing that happens. And it should not be like that. It should not be like that. I mean, low risk moms should be able to choose to go to a midwife without feeling judged or, you know, like we can't do this. And high risk moms should be able to come to the hospital and still feel safe with midwives who actually want to be there and want to make this experience special. That's why we get to use and get to wear different hats all the time.
That's right. Yes, this we've come a long way, and we still have a way to go. But it is important, as you said, is that you need to do your research if you are pregnant and have knowledge. And that's obviously difficult because you haven't studied this. We've studied it, right? And you actually want to trust your provider that you go to, all of them. But unfortunately, the world is a bit different out there. And I think it really illustrates itself, like you've worked in both in private sector, but we know that in South Africa we've got a cesarean section rate of, it's currently at 78%, whereas it should be maybe around 10 or 15%. That's a justifiable rate. So something is not right, and that must be extremely frustrating if you are a real midwife at heart. Susan?
Yeah. I've had to learn how to hold my tongue, which is not always easy if you really know me. In situations where the doctor pushes for that Caesar, and I'm like, I don't understand why. And I'm not pointing fingers to any specific one doctor, because I've worked with a lot of them, and a lot of them are really good and amazing at what they do. But there's this mindset of, okay, no, I'm not going to have you push for half an hour. I'm not going to have you push for 45 minutes. I would much rather just take you to a Caesar. And that I don't get. I don't get those moments where we take that mom's choice away, or when we scare moms to say, yeah, no, baby's head is too big. You won't be able to push baby out. I don't believe that.
No.
I don't believe that.
Yes.
So why don't we just give her a chance? And if it doesn't work, by all means, if baby goes into distress or whatever, then we go the theatre route. But give her body a chance. And those moments, those moments have sometimes it's been very frustrated. I've been very frustrated about it. And those little things, we have to do something. I feel like I've been pushing, and I know you've been pushing, and I know a lot of the people have been pushing to change those things, like pushing for Caesars and things like that, because it's not acceptable. We should be doing better. If we are bringing the next generation of little people into the world, we should be doing better.
Yes. And I'm sure, Melissa, you can testify from that, because you see the other end. You've chosen to let the natural way. And what is your cesarean section rate?
Well, last year, out of my patients that I looked after, I transferred 4 in out of the whole year.
Yes.
2 ended up having Caesars, but we kind of suspected they might have. We were thinking in the label already, we spoke about it, and 2 required vacuum extractions.
Yes.
And I mean, that's if you're looking at my whole year that I do. And I do 4 to 5 births a month.
Yeah.
I don't do more
That's
than that.
That's incredible.
Because that, for me, is a balance enough that I can balance my family and balance my work, and I can still get joy out of every of them.
Yes. And quality.
Yeah. And it also then doesn't spiral out of control that the mother becomes a number. The mother's not a number. And the minute you go more than that, you start forgetting things and the mother becomes a number. And I never want to have that.
Yes.
So I take about 4 to 5 births a month, and that's how I know. And I mean, out of that, only 4 transfers in a year. I was very blessed. Only 2 of them had Caesars. So, but again, I'm dealing with low risk. As long as that is just very clear. I mean, obviously, high is so different.
Yes, you screen them that they don't have medical conditions, etc. So let's just come to a landing. If you're pregnant and you're listening, I know the midwives that are listening, they all just say, yes, I know that side, and we all know the challenges. But yeah, just something that you could be aware of if for a woman, if she's choosing her birth professionals, some tips that you would give her. You've already touched on it a little bit. In short.
So if you do decide to go private and you want to be in a hospital situation, if that is where you feel safest, find a place or a hospital that has a very good midwifery team, so a good strong midwife team, find a doctor who listens and who hears you, and doesn't just tell you from 6 weeks, we're going to do a season, that's it. And don't be scared to ask questions. Ask 100 questions, ask 500 if you need to, and always listen to your inner mom voice. If something doesn't feel right, it isn't right. So speak to your midwives and speak to your doctor. And if you should decide to go private, when you walk into the ward, there is a culture where in midwifery, private midwifery, where we try to have one midwife with you for the whole 12 hours of her shift. So when you go in, get your midwife, talk to that person and set the expectation for the 12 hours. But move into labor ward, bring everything you want, and we will dance with you. We will get into the bath with you. We will do the birthing balls. We will do everything. We deliver babies on the floor if we need to. We are good with that. That's
Awesome.
us. Yeah.
That's great.
Yeah, so if you're looking at choosing your provider, like I say again, look at your stats, look at your round, speak to people what they've gone through. And you must realize that home birth is not for everyone.
Yes.
We have barely any interventions. We do not do interventions. We don't do pain relief. We let nature take its course. So that's not for everyone. I understand that, but also know that it's out there and know that you've been done, if it's safe, that you have a list of boxes you have to tick if you want a home birth. It's not just anyone can decide that. So make sure if you're wanting to look that side, look at the providers around, find out, ask around. There are so many forums nowadays. Ask around, ask your questions. Is this provider for you? Meet your provider. And I always say to my moms, if I walk out this door and you don't like me, that's fine. Tell me, if you don't like me, I'll send you names of other midwives so that you find who suits you, because that is a very personal thing. The same as it goes with your gynae, the same as it goes with your hospital. Go in, look around, ask questions, ask things. Not that I'm saying challenge every doctor, but ask doctors to explain. If you tell me to drink 4 of these tablets every day, if you don't tell me why, how, and all the rest, I'm not going to do it. So ask. And they'll be able to explain it to you. So find someone that matches your personality and matches who you are. And follow your heart. I have so many moms that phone me and say they wish they could have a home birth, but their husbands won't allow it or their parents-in-law won't allow it. Learn to follow your heart. And as a family, you decide what you're doing. Yes, but you need to also follow your heart.
Yeah, that's great. Yes, it's a good option. It's not a cheap option. I've noticed sometimes people wanting a home birth because they can't afford private care, and that is not a good motivation to have. So as midwives, we've learned if we smell that one. So it's a high quality option. It's a kind of care that you're getting. It's the natural approach. It's in the comfort of your own home, and you are at the center of your birth. Like, you need to own that birth. So yeah, it's definitely not for everyone, but for many it is wonderful. They have the most wonderful experiences. So obviously we have the government sector in South Africa, which is also a good option that most women have to make use of because of finances. Probably they don't have choice, but even there, to be empowered makes such a massive difference. So for women to just empower themselves, to know what birth is like and to own your birth, that is wherever you go is going to be it's going to help you so much, right? Yes. An empowered woman. Yeah,
definitely. Also in your government sector of
Yes.
knowing that you are allowed to walk,
Yes.
knowing that you are allowed to do the simple things like knowing it's important to empty your bladder,
Yes,
so that the head can come more down. So you can, going through, and I mean the sensitive midwifery side has got amazing things, going through their things, and I know they've got little antenatal things, looking at that, it's free, they've got so much free stuff on the internet. Look at that and prepare yourself.
Yes.
You can still have a good experience there.
Yeah.
I just want to mention with the internet thing, be very careful what you go read. So if it's like a reputable site like Sensitive Midwifery or something like that, then by all means read it, trust it, but don't just go Google and go down the rabbit hole, because then you'll just be scared and never get pregnant again.
Thank you. Thank you for saying that. Because that's why we have this podcast, and because it says it's mom and baby advice you can trust.
Yes.
So we hope to do that for you, because it can be quite a whirlwind out there. Find the advice you can trust. It's evidence-based. And we have, as you said, numerous blogs and resources, a free podcast, amazing antenatal courses. And then if you're a midwife that wants to be, a real midwife and reignite your midwife heart, we really need you. We need so many midwives. There's a shortage. Look into our Sensitive Midwifery site, what we all have on offer there. Certified Sensitive Midwife course is a big hit. It's coming up in July again. We're starting with the new intake. So yeah, thank you. Thank you so much. It was so nice to talk with you, and keep up the good work. And thank you.
Thank you.
Thank you so much. And thank you for allowing us to express and to address to the mothers what is currently happening in the environment, so that they can go ahead.
Yes.
And for always having our lives in your hands as midwifery and thinking about us.
Oh, it's my pleasure. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.